All right. Hi, Dave. So my name is Jennifer. I'm going to be your nurse today. I'm going to do an assessment on you, and I'd like you to remember my name because I might ask you to recall it later. So, apparent state of health. Are you in any pain today?
Nope.
And how would you rate your current state of health?
Very good.
Good. Can you tell me how old you are?
22.
And can you tell me what race or ethnic background?
I'm Caucasian.
And gender, so you're male.
Male.
Good. And how tall are you?
5'9".
And how much do you weigh?
163.
So you're a vigorous, healthy Caucasian male who is 22 years old with a weight of 163 and height of 5'9", which puts you in a BMI of 24, which is perfect, nice and healthy.
Sweet.
Dress, grooming, and hygiene are all appropriate. Mental status, so general demeanor is cooperative, affect is animated, and thought pattern is logical, relevant, and organized.
Nice.
Level of consciousness, I would give you a 5. You're very alert. And can you tell me your full name?
David Henry Thomas Snyder.
Can you tell me where you're at?
I'm in my height at Franciscan University.
Good. And can you tell me what day of the week it is?
It's a Friday.
Good. So oriented times 3. So now I'm going to ask you questions about your intellectual capacity. So can you tell me who was president before Joe Biden?
Donald Trump.
And can you tell me what my name is?
Jennifer DeLord.
Good. And can you tell me what the proverb means to not put all of your eggs in one basket?
Don't do everything for one thing, Put your eggs in separate baskets. Be the jack of all trades in a sense.
Good. Yes, exactly. And if it were pouring rain outside, how would you prepare to go outside?
My rain jacket and some rain boots.
Good. And good. So your intellectual capacity is all generally intact. So for vital signs, I'm going to start with your temperature. We're going to pretend that that's what I have in my hand.
Mm-hmm.
So I'm going to press a button, put it against your forehead, go around the side, behind the ear, release, and read off the temperature. And for pulse ox, I'm going to clip it on your finger like a clothespin and wait for it to stabilize and regulate and then read off that sign.
Perfect.
And now I'm going to take your blood pressure. Get it nice and snug for you.
Mm-hmm.
Alright. You can just rest your arm right there. Alright, I got 116/72. Is that normal for you?
Sounds normal to me.
Alright. Good deal. So now I am going to check your respirations and your pulse. So just hang tight and relax for me. All right, I got 66 for pulse and 14 for respirations. Is that all within your normal limits?
Sounds good.
All right, good deal. And finally, so you're having any pain?
No.
Okay, so 0 out of 10. Perfect. All right, so now moving on to head and neck. Your head is normal shape and you have normal symmetry, which means you're normocephalic. And so now I'm gonna check your hair. Comb it through there. Good. Your hair is appropriately attached to your scalp. As far as I can see, there are no lumps or lesions on your scalp, which is really good. And now I'm going to check your eyes. There it is. So as far as I can see, your eyes are properly aligned and you have appropriate prominence. So I'm gonna shine a light in your eye 4 times, 2 times on this side, 2 times on that side. And if you could just look at the brim of my nose, that would be great. Good. So pupils are equally round and reactive to light. So now I'm going to ask you to look at that object on that wall up there. And whenever I say ready, I'm going to ask you to look here at this pin line, okay? So look at the wall. Now look at the pin line. Good. Appropriate convergence and appropriate constriction. So now I'm going to do EOMs. If you could follow the tip of my finger without moving your head. Good. So cranial nerves 3, 4, and 6 are all intact with EOMs. So now I'm going to take a look at your ears. So symmetry, ears look nice and symmetrical. Lumps and lesions, as far as I can see, I don't see any lumps and lesions. Let me palpate. No palpable lumps or lesions either. And now I'm gonna have a look in your ears to see if there are any foreign objects or any redness. No foreign body, no redness. Take a look on this side. No foreign body, no redness. And how's your hearing?
Pretty good.
Good. Okay, so gross hearing is intact. So no foreign bodies, no redness, no drainage or discharge on either side.
Yep.
All right, now I'm gonna check out your nose. Do you have any difficulty breathing?
Yeah, my left side.
Okay, so let me check that out for you. So I do see that your vestibule is smaller on your left side than your right side, which would be some septal deviation. Have you talked to a medical professional about this?
No.
All right, well, I would highly suggest that if it bothers you. I also didn't see any drainage, which is really good. Do you have any difficulty smelling?
No.
Okay, good. So like moving on to your throat and your mouth, can you open wide for me? Good, so mouth is moist and pink, all looks intact, and your teeth, all of them look appropriate, no dentures noted, and no cavities as far as I could tell. And do you have any missing teeth or any loose teeth? Okay, good. No lesions in the mouth. I didn't pick up on any odor. And do you have any difficulty swallowing?
No.
Good. And now I'm going to check out your tracheal alignment. Good. Nice and vertical. Right down the middle. It's midline, which is appropriate. So next, I'm going to palpate your lymph nodes. And just let me know if you feel any tenderness as I'm going along.
Gotcha.
All right. Preauricular, postauricular, occipital, submental, submandibular. We have tonsillar, going down to superficial cervical, deep cervical, then posterior cervical, and supraclavicular. Any tenderness with any of that?
Nope.
Okay, all your lymph nodes are non-palpable. No noted tenderness. Now I'm going to palpate and see if I can get your carotid pulse. Good. Present, strong, 3+. Present, strong, 3+. Now I'm gonna listen to it, see if there's any turbulence. If you could hold your breath in, and I'm gonna listen to each side and then let out after that.
Sounds good.
All right, deep breath in, hold, breathe. No turbulence on either side. Good. So as far as skin goes, you have appropriate flesh tone, appropriate moisture as far as I can tell, and texture smooth, temperature nice and warm. Skin turgor snaps right back into place, so good skin turgor, and negative for lesions. So moving on to the lung and thorax, I'm going to listen to your anterior side. As far as I can tell, your size and symmetry looks to be proper. And shoulders, good, symmetrical. Clavicles, nice and symmetrical. Now I'm going to feel down your sternum. Good, nice and vertical. And ribs look nice and symmetrical as well, which means no deformities in your rib cage. So for respiratory excursion, if I could have you look that way for me and breathe deeply in and out of your mouth. And I'm gonna just grab right here. Deep breath for me. Out. Good. So your respiratory excursion was deep and symmetrical, which is all appropriate. All right, so now I'm gonna listen to your lungs. So if you could turn your head that way and breathe deeply through your mouth, but no quicker than normal. Good. Breath sounds were clear, even and easy, all the way through. All right, so now I'm going to assess your posterior lungs and thorax. So checking for any lesions, negative for lesions, and size and symmetry looks to be proper. And let's check to see shoulders are level, scapulae are symmetrical. And now I'm going to check your spine from your skull, clear down, all the way to your coccyx. All right, good. Spine is nice and vertical. Now I'm going to stand to the side of you to see if you have the appropriate S curvature. So sit up nice and tall for me. Good. appropriate S curvature. Now I'm going to check your AP versus transverse diameter. So AP. All right, good. So your AP is 1/2 the total transverse, and that is appropriate and indicates no barrel chesting. So respiratory excursion. So can you take a deep breath for me in and out? Good. Respiratory excursion is deep and symmetrical. So can you give yourself a big hug for me?
This.
Perfect. It just displaces your scapulae. And I'm going to give your lungs another listen back here. So breathe deeply through your mouth, but no quicker than normal.
Okay.
Perfect. Lungs were clear, even, and easy all the way through for both anterior and posterior. Rate was consistent with vital signs. Rhythm was regular. Depth was deep because I asked you to breathe deeply. But when you weren't breathing deeply for me, it was moderate inspiration, non-labored, negative use of accessory muscles, and no adventitious breath sounds. All right, so now I'm going to assess your heart. So inspecting for any pulsations, and I don't see any across there. Now I'm going to palpate for pulsations and thrills. So finding your angle of Louis, second rib, second intercostal space. So aortic site, second intercostal space, negative for pulsations, negative for thrills. Moving over to pulmonic, second intercostal space, negative for pulsations, negative for thrills. Down to Erb's point, third intercostal space, negative for pulsations, negative for thrills. Fourth intercostal space, negative for pulsations, negative for thrills. Tricuspid, fifth intercostal space, negative for pulsations, negative for thrills. And moving on to the mitral, fifth intercostal space, midclavicular line, PMI. Pulsations are positive and thrills are negative. So location, so PMI is in the fifth intercostal space, midclavicular line. Rate is consistent with vital signs. Rhythm is regular, intensity strong. Diameter is appropriate in the fifth intercostal space and nowhere else. Duration was appropriate as well. So now I'm going to listen through those auscultatory sites. All right, appropriate relationship with S1 and S2. Rhythm was consistent with vital signs. Rate was consistent with vital signs. Strength was strong and no extra heart sounds heard. Now checking for JVD. Right. All right. So I see a little bit of oscillation going up right there and right there, but it's nothing to be concerned with. So no presence of JVD. Now for your abdomen, would you mind if you lift your shirt up? Mm-hmm. Perfect. So inspecting your abdomen, so looks non-distended. Bowel sounds, I'm going to listen for 1 minute. All right, so for bowel sounds, I got 16, and the normal limit is 5 to 34, so that's within the normal range. So normal active bowel sounds. So do you have any abdominal pain anywhere?
No.
All right, so now I'm going to percuss your abdomen. Good. I heard tympani all the way around. All right, are you feeling any pain or tenderness anywhere?
Nope.
All right, so now I'm going to palpate your abdomen. Let me know if you feel any tenderness as I go along. Any tenderness with that?
Nope.
All right, good. I did not detect any organomegaly or no bladder distension, no pain or tenderness, and no lumps or lesions seen anywhere on the abdomen. All right, so I can have you sit up for me.
Perfect.
And dingle your legs. So now I'm going to ask you about your bowel habits. So have you had any accidents with bowel movements?
No.
Good. And color of bowel movements?
Say about like brown.
And consistency?
Say like soft, like round and like solid.
Good. And how much is the amount usually?
I'd say like a fair amount, like nothing too crazy or not enough.
Good. Frequency. So how many times a day or a week do you usually?
Like 2 to 3 times a day.
Good. And when was your last bowel movement?
I would say like a couple hours ago.
Good. So moving on to genitourinary.
Mm-hmm.
So is there any tenderness or lumps or lesions that you've noticed in your groin area?
Nope.
Good. And so bladder habits. Any accidents with urine?
Nope.
Color of urine?
Say more on the clear side. More like clear to yellow, like slightly yellow.
Okay. And so clarity is clear.
Clear.
Good. And the amount. So does what's going in to seem to be the same amount as what's coming out?
Yep.
Good. So quantity is sufficient. So moving on to the musculoskeletal part of the assessment.
Mm-hmm.
Do you have any joint pain in your body?
Nope.
Good. And do you have any limitations or joint stiffness?
Nope.
And do you experience any like snap, crackles, or popping in the joints?
No.
Good. All right. So moving on to extremities. Appropriate flesh tone all the way throughout. And now I'm going to check your temperature. Appropriate temperature. Nice and warm. Your feet are a little cold, but that's okay because we're in a nice air-conditioned room. And so pulses. I'm going to check your radial pulse first. Good. Pulses are present, strong, 3+, and symmetrical. Posterior tibial. present, strong, 3+, symmetrical. Now dorsalis pedis. Present, strong, 3+, symmetrical. Good. So now I'm going to assess capillary refill. Good, nice and brisk. Good. Nice. Capillary refill is brisk. So edema is negative, no sign of edema. Now for your neurological assessment. Can you grab onto my fingers? Squeeze hard. Now push, pull. Good. I give it a 5. That's about normal strength. Now for your lower extremities, can you push against my resistance? Back. Now your feet up, down. Good. 5 again, normal strength. And for coordination, can you walk to the door and back for me?
Mm-hmm.
All right, and sit back down for me. Good. And are you experiencing any sensations like numbness, tingling, pain, or any decreased sensations?
No.
Alrighty, good. Now for deep tendon reflexes, I am going to do your patellar one now. Good. I give that a 3+. 3+. Good. Now for your bicep, I'm gonna lift your arm up and can you dangle your arm down for me? All right. Good. That was like a 2+ right there. Okay. Good. 2+. Now lastly, can you recall my name?
Jennifer DeLord.
Good. And it was very nice to meet you and to do an assessment on you. And that concludes my assessment.